So this video continuation of ANS. Before starting the chapter, we must understand their action. It is very easy for understanding the four chapters: cholinergic, anticholinergic, adrenergic, and antiadrenergic. The four chapters will discuss one by one. First, their action. So this one is the central nervous system. So this one is the relaxed state. This one is that emergency state. So see various organ. Okay, eyes. In the eye we have pupil. Then salivary gland. This one is the salivary gland. Then heart. Then lungs. Then GIT. Then urinary bladder. Each of our organ, both the nerves, okay, sympathetic and parasympathetic. Now which nerve is active in all the organ? In my eyes, in my salivary gland, in my lungs, in my heart, in my GIT, in my urinary bladder, in all my organ, which nerves is activated? Each organ is supplied by both. Just suppose my eyes, it is having sympathetic also and parasympathetic also. In our salivary gland, sympathetic also, parasympathetic also. Heart, lungs, GIT, everything sympathetic also and parasympathetic also. So currently at a time one is activated, both cannot activated. Suppose sympathetic activated means this one not activated. Suppose parasympathetic not activated. Parasympathetic activated means sympathetic is not activated. So both cannot activated. Currently one is activated. So if currently we are relaxed, suppose we are in relaxed, means whenever we are relaxed, that time parasympathetic come its action. Whenever we feel relaxed, that time parasympathetic come it action. Parasympathetic means relaxed. Suppose I am reading, I don't have any tension. But imagine there is a lion in front of me. I have to save my life. I have to run. It is life-threatening condition. At the time inside my all the organ sympathetic stimulation will be there. So that one is the emergency condition sympathetic. Normal relaxed state is parasympathetic. So whenever we are relaxed, there is parasympathetic. Whenever there is emergency, sympathetic. So we correlate the function also. Now for example, whenever we relaxed, we don't want to our eyes, okay, this pupil too much open. Normally means like this, then otherwise too much open. So we are relaxed, small vision only. We are relaxed time, small vision only. It is meiosis. In the pupil there is meiosis, but whenever there is a line, I want to increase my vision. Okay, I want to increase my vision. I want to run everywhere. So here mydriasis. Okay, so meiosis and mydriasis. So in parasympathetic there is meiosis. In sympathetic there is mydriasis. So in the eye we have both. Whenever we record that time meiosis, whenever we record that time mydriasis. Normal relaxed condition, that time mitosis, emergency condition mydriasis. Another example, we feel hunger. My saliva, that salivation is takes place. so increased salivation is there. But whenever there is a lion in front of me, I don't have time to eat. It is emergency situation. At that time, we don't record saliva. So saliva production decreasing. Coming to our heart. Currently, we are simply sitting. Our heartbeat is normal, maybe 80 to 100, but the heart rate is normal or reduced in normal condition. Okay, heart rate. But in the line in front of me, my heart will pump like anything. It will be more than 120 or maybe 150. So heart rate will increase here. So it will increases contractility, heart rate and velocity. Everything will increasing at that time emergency. So if there is an emergency, everything is less or normal. Okay, normal time less or normal only, but emergency condition it increase. So next, coming to lungs. Currently I am sitting normal, relax. I don't record much oxygen. I am sitting calmly, coolly, so cool way only. So broncho construction is there. Lungs broncho are not dilated, less oxygen is required, but there is lion. I have to run. I required more oxygen, so at that time bronchodilation. So we want to correlate everything. So in next one is urinary bladder. Whenever we are relaxed and whenever the bladder is full, we can go, we can use washroom, we can micturate. Okay, micturate, we passing urine. If we can avoid at that time urinary bladder, may you have urinary bladder, we have two things here. We have urinary bladder, here we have destituture, then here we have sphincter. Okay, so we have two things. What is the things? Destituture muscle. Okay, here we have destituture muscle, here we have sphincter. So whenever we want to avoid, what we have to do here? Okay, this is contract. The destituture muscle has to contract. Destitution muscles has to contract. The sphincter has to relax, so urine will come out. So to contract, uh, to micturate, to urinate, we have contract the testuture and we have relaxed that sphincter. So contract testuture and relax sphincter, then only urine can come out. Otherwise texture will contract and sphincter will release, then urine will come out. But whenever we don't want to avoid, okay, we don't pass that urine, at that time we relax texture, texture, so that urine can accumulate here only. So that urine can accumulate here only, we contract that sphincter so that urine don't come out. We contract, so everywhere we want to avoid, contract the testuture and relax that sphincter. Whenever we don't want to avoid the urine, at that time we have to relax the testuture and contract that sphincter. So during parasympathetic situation stimulation, during parasympathetic stimulation, during relaxed state we avoid, so that is parasympathetic. But during emergency we don't have time to micturate, we don't have time to passing urine. There is a lion, we cannot use the toilet at the time. So this is sympathetic. So sympathetic will happen. All organs. opposite to each other, but male sex organ there are complementary, there are not opposite. Say for example, one is doing erection, okay, one is that parasympathetic will do erection, and one is doing ejaculation. So during sexual intercourse, because there is a reaction and then there is rejection, there is not two opposite things, there are two complementary things. So here parasympathetic stimulation causes erection of that penis, sympathetic stimulation causes erection. So only at that male sex organ the action is complementary, but at all other organ action is opposite. So here increase salivary secretion means here decreasing secretion, like that opposite only except male sex organ. So actions of various organ, eye, salivary gland, heart, lungs, urinary bladder, both have nerves. Okay, both are having sympathetic and parasympathetic nerves. Say for example, eyes having sympathetic and parasympathetic nerves. Salivary gland having sympathetic and parasympathetic nerves. At a time, one is activated. This one activated means this one cannot activated. Parasympathetic activated means sympathetic cannot activated. Say for example, this parasympathetic normal relaxed state, people like this. Yes, emergency condition like this. So relaxed condition, parasympathetic nerves come with their action. Example, simply sitting. That sympathetic stimulation. When imagine when line will come, that time that sympathetic nerves will come to their action. Parasympathetic system there is meiosis. Sympathetic system there is mydriasis. Another example, salivary gland during hungry time, normal time it will increases, but emergency condition means it decreases that saliva. Heart also normal heart rate 80 to 100. In front of mean lion means it increases like anything 120 or 180. So that time it increases contractility, heart rate and heart velocity. Everything will increasing. Notes format. So we have two type of this one is the urinary bladder, this one is the destituture muscles, this one is the sphincter. Okay, so contract that these destituture muscles and sphincter has relaxed, that time only urine will come out. This destituture relax, urine accumulated, that time urine accumulated here. If don't want to pass urine means that time this that this one destituture become relaxed, that time only we never passing that urine, that time that sphincter contract. Next, moving to eye chapter. Eye is a ball like structure, okay, like a ball, eyeball. In eyeball we have iris, this one is the iris. The center of the iris we have hole which is known as pupil, and the pupil is small, this one small, it is miosis. When it is dilated, that time it is mydriasis. When it is small, that time meiosis. When it is dilated, it is mitosis. So, contracted meiosis and mitosis. When we have meiosis and mitosis, if we cut, okay, we cut here, see the iris, okay, see that iris like a curtain. Can you see the complete iris? Okay, complete iris like a curtain with a hole at the center. Okay, okay, this one like a circle curtain. So this is iris. In this iris, there are two type of muscles. First type of muscle, it is known as sphincter pupillae. All okay, that sphincter pupillae. This one is the iris. This first type of muscles, sphincter pupillae. These all the sphincter pupillae all are contracting. The pupil will shrink. It will causes meiosis. Okay, the pupillae will shrink during contraction. This name is called as meiosis. So, sphincter pupillae causes meiosis. Sphincter pupillae contracting causes meiosis. This dilator, okay, this one is the dilator one. This one contracting causes mitosis. So the dilator pupillae, it is longitudinal sphincter. Okay, this dilator pupillae contracting together. So the pupillae is dilated. Okay, so this one is dilated. This one is dilated. Here that sphincter pupillae is contracting, pupillae is meiosis. Here the dilator, this one is the dilator. Pupillae is contracting, so pupillae is doing mitosis. So here this one is the mitosis, this one is the meiosis. So the dilator pupillae is contracting. Dilator pupillae is contracting. Its name is called as mitosis. The sphincter pupillae is contracting. This one name is called as meiosis. So dilator pupillae causes mitosis. Dilator pupillae causes mitosis. Sphincter pupillae causes meiosis. So now, which muscle supplying which muscle? Sphincter pupillae supplied by parasympathetic one. Parasympathetic one. Dilator pupillae supplied by sympathetic one. Okay, sympathetic nerves. This sphincter pupillae supplied by parasympathetic nerve. Dilator pupillae supplied by sympathetic nerve. So, whenever we are relaxed, our pupil are small. But whenever there is emergency, our pupil are dilated. You can see whenever that sphincter pupillae contracting, what will happen? Meiosis. It is known as active meiosis. Okay, sphincter pupillae causes active, sphincter pupillae causes active meiosis. When sphincter pupillae will relax, what will happen? When it will contracting meiosis, when it is relaxing it is known as passive mitosis. Okay, it is known as passive mitosis. It is not actual mitosis, it is passive mitosis. When dilator pupillae is contracting, it causes active mitosis, actual mitosis. When dilator pupillae is releasing, causes passive meiosis. So that sphincter pupillary supplied by parasympathetic, then dilator pupillary supplied by sympathetic. So whenever it will contract and it will causes meiosis, but whenever there are relaxed, they will do opposite. Instead of meiosis, there is mydriasis, that is the passive one. Relaxation, passive one. Next, cholinergic drug, what they will do. Anticholinergic drug, what they will do. What adrenergic drug will do. What anti-adrenergic drug they will do. This cholinergic drug is parasympathetic stimulation. They exaggerate the parasympathetic. Okay, they exaggerate the parasympathetic. So they causes contraction of what? Sphincter fibulae. They contraction of sphincter fibulae. Since they causes contraction of sphincter fibulae, they causes active meiosis. Then what cholinergic drug will do? They will oppose the cholinergic. They will oppose the contraction of sphincter fibulae. Okay, so this one is opposite. Contraction of sphincter fibulae. So they will cause the relaxation of sphincter fibulae. Once it relaxed of courses it mydriasis. So but it is not real mydriasis. So that reason only it is called passive mydriasis. Next, adrenergic drugs, what they will do? It will contraction of dilator bibilion. So it will causes mydriasis, but this is active real mydriasis. It is due to contraction of muscles. Last one is anti adrenergic drugs, what they will do? It will causes relaxation of that dilator pupillae. Once they dilated that pupillae, it is relaxed. It is meiosis, but it is not real meiosis. It is passive meiosis. That's why this one is equal to this one, this one is equal to this one. So first start with cholinergic drug, starting with the ANS. In this one we want to discuss drugs mechanism of action, uses, contraindication. Okay, here ANS, see this diagram we want to discuss here. See here acetylcholine. Acetylcholine, there is a neurotransmitter. First understand acetylcholine. We understand the acetylcholine, the things will be simple. So this one, can you see this one? It is presented in that axon. This one is the axon. It is released out here. So this one is released out here. And it is acting on, okay, what are the organ is presented? Say for example here heart. So it is acting on that muscarinic and neuronicotinic receptor. So here it will act on that receptor. Here this muscarinic receptor is this one neuronicotinic receptor. So this acetylcholine react here. How it get synthesized? In that axon, in the axon of that neuron. So this one is the axon of that neuron. Inside there is a vesicle. Okay, inside neuron there is vesicle presented. Inside neuron there is vesicle are present, inside which this one acetylcholine is present. So neuron, then vesicle, then acetylcholine are present. So this one is the axon. After that, that vesicle, then acetylcholine is presented. So whenever that action potential is coming, that acetylcholine secreted out. Okay, normally it is presented here only. When that action potential will come, that time it will secreted out and acting on that muscarinic and nicotinic receptor. So how does it synthesized? So how does it synthesized? See, this one only we are zooming that diagram here. So zooming out this portion, this is terminal axon. This one is the terminal axon. How does the acetylcholine is synthesized? It is synthesized from amino acid choline. Okay, so first that choline go inside, that choline get acylated, it will form acetylcholine. So after that it will form acetylcholine. It is stored in our cycle. It is presented here only. Okay, it is presented here only. So it will remain in our cycle only. First that choline will go and get acylated, then it will remain inside the cycle. This is how, and whenever the action potential coming, so whenever that action potential coming, that action potential is coming, at that time that vesicle are fused, these vesicles are fused, that acetylcholine is released out, this acetylcholine is released out, that vesicle are fused with that external membrane. Okay, that axon, the so external membrane. So whenever action potential is coming, at that time neuron become depolarized, that acetylcholine vesicle are fused. Okay, here fused here, it will released out, act on its receptor. So it released out, after that it will act on its receptor. Two type, M receptor and N receptor. What are the two type of receptor? M stand for muscarinic receptor, N stand for neuronicotinic receptor. So it act on its receptor. How does the destruction occur? Once that acetylcholine is come out, it will acting on this muscarinic and nicotinic receptor presented on the organ. So this one is the organ. It will act therefore fraction of millisecond. Okay, it will act for fraction of millisecond. It will act, there is only fraction of millisecond. After that there is a enzyme. Okay, so after a fraction of millisecond, there is a enzyme. The name of the enzyme name is called as acetylcholine esterase. They will cause hydrolysis of acetylcholine. So they will cause hydrolysis of acetylcholine. So the action is terminated. So it stop that action. Action are terminated. Action is terminated, it is not forever. So this is how acetylcholine is synthesized, released, and action is terminated. So choline is an amino acid, it will come from blood, it get acylated, it will form acetylcholine, then it will go inside vesicle and stored there. So it remain here only when that action potential will come. Okay, when that action potential will come, at that time that vesicle are fused with that axonal membrane, that acetylcholine will secrete out, it will secreted out and it will act on that muscarinic and nicotinic receptor. It will causes that action, whatever is that action depending on that organ. It will show its action. Suppose if it is heart, it will reduce that heart rate. If it is salivary gland, it will increases that salivary secretion. Whenever whatever it is that organ, if it is eyes, it will causes meiosis. The organ, it will show its action. After that, there is an enzyme. That name of that enzyme, acetylcholine esterase. After a fraction of millisecond, once the action is over, it will hydrolyze and gone. It is hydrolyzed and gone. Discuss about two type of receptor, muscarinic receptor and nicotinic receptor. Muscarinic receptor are three types, M1, M2, M3. The nicotinic receptor two types, NM and NN. Totally five type of receptor. This NN is not important. Where that M1 present, where does that M2 present, where does that M3 present in human body? There is in human body M1 presented in our brain, in that ganglion and that stomach, brain and stomach. M2 present in our heart, M3 presented in entire body, entire visceral muscles. Visceral muscles is a smooth involuntary muscles in our entire GIT, in our lungs, in our urinary bladder, sphincter, all the involuntary muscles M3 present. In the eyes also M3 present. In the gland, salivary gland, sweat gland, then blood vessels also, male sex organ also it is present. Then that NM is presented on neuromuscular junction. Yeah, this one is not important one. This one is the classification we already known. M1 is presented on our brain and stomach. M2 presented on our heart. M3 presented mainly in five places. It is presented in all visceral muscles. Important five. One is GIT, lungs, urinary bladder, that sphincter. Apart from it is presented in eyes, salivary gland, blood vessels, and male genitals. Next, we want to discuss their function. In brain, it causes learning, cognitions. Okay, learning we need. In the stomach, it will secreted acid secretion, increase acid secretion. M2 decreases that heart rate, decreases that contractility, and decreases that velocity. So M1 function in central nervous system, brain, learning and cognition. Stomach increases that acidity. M2 in heart, it decreases that heart rate, contractility and velocity. So all the things decreases, rate, heart rate, contractility and velocity. It is a parasympathetic, so everything will less. Third one is visceral muscles causes contraction. GIT, contraction means relaxed. Currently I am relaxed, so I can learn, I can do that cognition. So I am having acid, my heart rate is low, my velocity, that my heart velocity is low, contraction is low, my GIT is contracting, I am having the contraction, my lungs also contracting, broncho constriction because I don't require much oxygen because I am relaxed. This is complete relaxation state. Urinate if I wish, I can micturate. So The this texture muscle contract and that sphincter dexturature muscles contract sphincter muscle relaxed. So the gland secretion or takes place, salivary gland secretion is taking place, exocrine gland takes place, sweat gland takes place, but in emergency they all will reduced. So all the secretion is there in the eyes. I am having meiosis right now because now relaxed state. In male sex organ, here erection is there not ejaculation. Ejaculation is the sympathetic. Apart from we have that NM present on neuromuscular junction, it causes contraction of the muscles. After that only we will move to our chapter.